Anxiety, chaos, and UNISA. You might be wondering, what will this presentation be about? This presentation will focus on defining anxiety and its causes. We will also differentiate between stress and anxiety. Furthermore, we will also focus on the concept of worry. It will also be important that we explain the symptoms of anxiety and worry. In addition, we will look at the triggers as well as alternative coping strategies. What is anxiety? Anxiety can be described as just a normal adaptive response to experiences, and everyone experiences this. When we say we are anxious or we are experiencing anxiety, is when we feel that we are worried, tense, or afraid, particularly about things that are about to happen or which we think could happen in the future. Anxiety can be regarded as a natural human response when we perceive that we are under threat. It must be noted that when we are talking about anxiety, it can be experienced through our thoughts, feelings, and physical sensations. We are now going to look at the causes of anxiety. Of course, there are so many factors or circumstances that can cause anxiety, but we will now quickly look at just few. One of the things that could really create anxiety, it could be our thought process. So our thinking could feed into anxiety. How you think about yourself or the people around you. For example, you think you are a bad person. Secondly, anxiety could be triggered by environmental factors or internal factors. When talking about environmental factors, I'm now thinking about our experiences of load shedding. As a student, you might be worried when you have to submit an assignment or you have got a lecture to attend. Already, if you are thinking, I will be in load shedding or will there be load shedding, that could cause a lot of anxiety. Furthermore, anxiety could be related to UNISA experiences or unrelated to UNISA. For example, your experiences of UNISA when there is a strike, that could create so much anxiety when you cannot access the academic support or the administrative support. Furthermore, we need to focus on our unhelpful thinking processes and thoughts. What do we mean by that? One of the unhelpful thinking process is mind reading. That's when we assume that we know what others are thinking, usually about us, when there is no evidence, and it's normally only your own thoughts. Another type of thinking that could be very unhelpful is when you look at things in black and white, thinking that things can only be one way or two ways, good or bad, right or wrong. It's important to allow for gray areas. You need to realize that the goal is not to eliminate the feelings of anxiety. Rather, our focus is on developing life skills to manage the anxiety triggering situation. In other words, we are developing coping skills, we are developing a buffer, we are developing awareness that could help you to cope with anxiety. Let's now differentiate between stress versus anxiety. What is everyday stress? How do we see that this is part of everyday stress? And then how do we see that now we are experiencing an anxiety disorder? Let's first look at what happens when one experiences everyday anxiety or everyday stress. The following factors play a role to conclude that this is everyday stress or anxiety. One, everyday stress or anxiety is in response to a known environmental factor. Furthermore, the symptoms go away when the stressor goes away. So I am anxious because I've got a due date for 3 assignments, which is Friday. But once you submit those assignments on Friday, you will feel much better. It could also be about worrying about important life events, such as passing a subject, moving, or a romantic breakup. Everyday stress could also be related to embarrassment or being self-conscious in an uncomfortable or awkward social situation. For example, you might feel very nervous about meeting new people. You have got an appointment with your lecturer and you are anxious, will I ask the right questions? Will my questions be clever enough? When this happens, you might start feeling nervous or sweating even before a big test, a class presentation, a stage performance, or other significant events. Furthermore, you need to realize that everyday stress could also be related to realistic fear of a dangerous object such as a snake or a place. We also experience everyday stress when we are feeling or making sure that we are healthy or live in a safe environment. When you realize that you are in a room, but you are not sure whether the doors are locked. How does then differ from anxiety disorder? Anxiety disorder is a response to an unknown source or in response to the experience of stress. Symptoms will always remain despite no identifiable stressor. And what then happens? There is constant and unsubstantiated worry that causes significant stress and interferes with your daily life. This now impacts on your life because you further avoid certain situations, social situations, due to fear of being judged, embarrassed, or humiliated. Sometimes when you have got this anxiety disorder, you also experience panic attacks that seems to be out of the blue, and you also have this preoccupation with the fear of having another one. You are constantly experiencing irrational fear or avoidance of an object, place, or situation that possesses little or no threat of danger. For example, you could be afraid of going to the malls because you feel uncomfortable. Not that you are scared that there will be a hijacking. Sometimes some people will report that I'm scared of people. When you experience anxiety disorder, there could be a tendency of performing uncontrollable, repetitive actions such as excessive cleaning, checking, touching, or arranging. This is a way of relieving the anxiety and the tension. We can now move and focus on worry. When we experience anxiety, worrying about the worst case scenarios and overthinking becomes one of the issue. And also this increased anxiety and the cycle just continues. We can now look at what we could then refer as the two types of worry. There is a real problem worry. And this type of worry affects you now and have possible solutions. I am worried about the due date of my assignment that is approaching and I'm not ready. There is a real issue there. And you can then also start at the solution like, I need to sit down or seek for support so that I can do my assignment on time. So it also provokes problem-solving attitude and then offers a degree of control. Another type of worry is a hypothetical worry. It means that these are things that does not currently exist but possibly could happen. For example, maybe I will not get a job when I finish my degree. The question you need to ask yourself is worry preventing you from living the life you truly want? We spoke earlier on about anxiety disorders. You need to understand that anxiety disorders is also categorized. As people experience this impairment or distress in academic, occupational, and other important areas of functioning, it also presents differently. For example, you will find that there are people who worry about social event or social situation. That is normally described as social anxiety. So this person will have chronic worry, but their worry is only related to social situation. Then you will have another person who experiences generalized anxiety. So this person is constantly worried about everyday things that do not worry most people. Then we also have panic disorders. This is characterized by panic-like sort of feeling where somebody feels like they are losing control or they experience chest pain, racing heart, as well as shortness of breath, accompanied by dizziness. There could be other people who will report that they then report certain types of behavior, like people would describe them as obsessive compulsive, excessive rumination, thinking, and repetitive behaviors to reduce anxiety. In conclusion, with regard to the different types of anxiety disorders, we also have phobias. Phobias is specific fears that are excessive in nature and often lead to avoiding that what is feared. For example, it could be heights or tunnels. I would want now to explain how stress works. It normally starts with a situation or an experience. You experience a situation that produces certain feelings. Remember that when we are talking about a situation, it could be a situation created by your own thoughts, or it could be a real situation. That will already activate the threat system in your body. The threat system, once it's activated, you respond in either one of these ways. Either you will fight or you run away, which is normally described as a flight, or you will freeze. After that, there will be emotional and cognitive assessment. And finally, you will behave accordingly to how you are thinking about the situation, how you are feeling, and how you are thinking about that situation. Just for interest's sake, just for any activity for you, I would want you to just write down a few words that describe what anxiety means to you. I now want us to focus on what anxiety looks and feels like. Of course, each one of us, when we are anxious, we will experience or we will look or we will feel different. Some of us could report difficulty with sleeping when they are anxious. Others will have challenges with struggling to breathe. And then there could be report of chest hurting or feeling tight. There could also be an overall report where one would say, I'm just feeling sick. Others start sweating a lot when they are anxious. You could also feel very restless or observe that somebody is very fidgety. Other people will report that when I'm anxious, I feel my mouth is dry, and they would request, I need water. In some of us, our hearts will be like racing. It could also be racing thoughts at the same time. You could also feel shaky or dizzy. Other people, when you are feeling anxious, it could work on your biological system where you feel like you've got a need to go to the bathroom or the restrooms. As we continue with what it feels like, we can focus on the physical symptoms where you will find that there is fatigue, grinding of teeth, headaches, or muscle cramps. When it comes to cognitive, you might have problems with concentration or problem solving. You can also become forgetful, or you experience nightmares or blaming others. Behaviorally, we could see that there is change in activity. I don't have interest in doing the things I used to do, or I don't have energy to complete my assignment. There could also be change in appetite. We could also avoid other people and withdraw. Finally, emotionally, you could start feeling anxiety, anxious all the time. You could feel guilty, irritability, or feeling uncertain all the time about yourself, the future, or other people. Let's now talk about the strategies or responding differently to manage. The first thing is about being hopeful. Part of this presentation is to increase your cognitive awareness so that you can be able to separate what you are dealing with, whether you are dealing with the issue that you are currently dealing with now or related to the past. It's also important to remain being hopeful by reflecting on what is happening to you as a student. And with that, you need to check, how is UNISA provoking you, perturbing you, and why are you suddenly feeling so overwhelmed? Why UNISA and the studies is so overwhelming for you? The focus for that is on how you can acknowledge and then identify a way forward based on your resources and capacity. Reflect on what you are experiencing. Thirdly, it's also important to identify what you are feeling and what you are scared of. Because at times, anxiety can be unresolved issues that can be coming to the fore. The current anxiety-provoking situation just feeds to the past anxieties. It's important to also look at the triggers. With the triggers, remember there could be an event or occurrence that activates and provokes feelings of anxiety. So sometimes with this anxiety, we are responding to an internal stimuli, which could be emotional, where you are feeling down, or a mental image that are replaying in your mind, or a physical state like a tight chest, or even your thoughts where you are like, I might fail the assignment or the test. In other cases, it could be a response to an external stimuli, where we are talking about the presence of others, the physical setting, or social pressure. Even an activity like going home for holidays or visiting a friend. Reframing our situations or experiences could be another way of helping us with anxiety. You could then ask yourself, what are other ways of looking at the situation that I'm experiencing? Also, you can check whether you are looking at the whole picture. Another important thing as part of reframing is to think about more helpful ways of picturing the same situation. Because when you do that, it also helps you when you can start looking at unhelpful thinking style and helpful thinking style. There are two things that you need to think about. What is the evidence that my thoughts are true? Is there an alternative way of thinking about this situation that could be more true or closer to the reality? Another important aspect is, what is the probability that my thoughts will happen? What are some other things that could happen that are equally, if not more probable? As we continue with alternative response behaviors, You could also look at what could I do in the moment that will be more helpful. Instead of feeling this anxious, is there something I can do? Furthermore, what is the best thing to do for me, for others, or for the situation? In addition, you can also think about, if my feared situation happens, how will I cope? What coping skills can I use to handle my feared situation? You could also reflect on, what have I done in the past that was successful? As you work on alternative response behaviors, it's also important to say, do I need to work on acceptance, letting go of control, or being okay with the less than perfect, or having faith in the future and myself? It's also important to breathe to help us and focus your attention on your breathing. Imagine that you have a balloon in your belly, inflating on the in breath, deflating on the out breath. Another part of alternative response feelings would be, what might it feel like if I thought differently? When I'm not feeling this way, do I think about this situation differently? Furthermore, you could also look at your strength or positive that you have, or the situation that you might be going through, or even things that you might be ignoring. You could also ask yourself, what else is this anxiety related to? Is it really about feeling worried about the assignment, or there are other things that I'm ignoring? And at this time, you can tell yourself, this feeling will pass. It's a normal body reaction. Some important part of coping strategies could involve breathing techniques, writing things down that are bothering you, meditation, or reframing. You can also try some of these apps that have got useful tips: ACT Coach, Breathe to Relax, Breathing Techniques by Himalaya, Mindfulness Coach, or Mind Shift. Of course, there could be more. It's also important to practice grounding techniques. There are a number of grounding techniques that I would briefly touch on. One of them is to remind yourself of who you are right now, or at that particular time of the anxiety. You could state your name, age, or things that are around you. Take 10 slow, deep breaths. Focus your attention on each breath, on the way in and a way out. You could also splash water on your face, or place a cool wet cloth on your face. Furthermore, you could also pay purposeful attention as you hold a cold, it's important, non-alcoholic drinks. Feel the coldness and the wetness on the outside. You could also find a grounding object to hold, look at, listen to, or smell. You could also listen to music. When you listen to music, pay close attention and listen for something new or different, maybe how the instruments are being played. And if you wake up and you are suddenly feeling disoriented or distressed at night, it's important to remind yourself of who you are and where you are. Look around the room and notice familiar objects and name them. Finally, feel the clothes on your body, whether your arms, legs are covered or not. Good sleep hygiene is very important, and to maintain sleep hygiene, there are a number of things that you might need to practice, such as avoid caffeine and nicotine at night or even during the day if it impacts on your sleep. Avoid alcohol. Develop sleep rituals. What time do you sleep? What time do you wake up? no clock watching, also experience or practice electronics curfew. I switch off my gadgets at 7 so that I go to bed at 8. Keep day and night time routine the same. There are a number of resources that are available online. Some of them is the ACESO, the Life Mental Health, and 6 things that happen to your body when you experience anxiety. There are links provided. You must also remember the South African Depression and Anxiety Groups offers a higher health helpline for all registered students and staff. They offer free online virtual session with a qualified psychologist. You can then contact them if you need help. There are some of the references you can use in line with anxiety topic. Remember, you can contact us should you need further support or you need to have a conversation with a counselor. Please send us an email to counseling@unisa.ac.za. Thank you.